सो एंजाइटी जो डिसऑर्डर्स होते हैं उसके जो सिम्टम्स होते हैं वी क्लासीफाई दैम इनटू टू पीस साइकोलॉजिकल एंड फिजिकल. तो साइकोलॉजिकल में हमारे पास ऑफ कोर्स वी आर गोना बी थिंकिंग अबाउट जो भी साइकोलॉजिकल डिसऑर्डर्स यू कैन जनरली पिन के एंगजाइटी में क्या होंगे. फर्स्ट ऑफ ऑल इरिटेबल होगा बंदा बिकॉज देर एंक्शस, देर सेंसिटिव टू नॉइज बिकॉज देर एंक्शस, दे डोंट वांट टू हियर अ लॉट ऑफ लाउड नॉइजेस. They'll be restless, they'll have a hard time concentrating. Why? Because they're concentrating on their worrying thoughts. So think about it this way. Anxiety जब होती है तो बंदा has worrying thoughts. This leads to poor concentration. ठीक है, because they're so focused on worrying thoughts, this leads them to be restless. And because they're so stuck up in their head thinking about their own thoughts, it makes them sensitive to noise. And because all of this is going on, so it makes them irritable. Anxiety, we already know. Think about you giving an exam. The sort of symptoms, physical manifestations that you would see as a dry mouth, palpitations, headache, breathlessness, tightness in chest, dizziness, and insomnia. But there are different types of anxiety disorders. इसमें मैं मेन मेन बातें बता देती हूँ. सबसे पहले there is agoraphobia. ठीक है, go and then ये I'd rather RO stands for rather not. ठीक है, so ago no. ठीक है, because this person is afraid of leaving home and going to public places. Why? Because they think something bad is going to happen. तो इसमें जो diagnostic criteria है कि the person is afraid of crowds, number one, of public places में usually crowds होते हैं, and of being alone in these crowds. So they could go out with someone but they're afraid of going out alone, and it's because they think something bad is going to happen. That's agoraphobia. The way to remember it is ago, I'd rather not. ठीक है. सोशल फोबिया बेसिकली क्या है कि सोशल फोबिया इज can't eat, can't speak. ठीक है, that's what social phobia is. Can't eat, can't speak. So can't eat in public because the person doesn't want to go out there. They feel conscious eating in public and they feel conscious speaking in public, especially if it's to the opposite gender. अब उसके क्या दो reasons हैं कि they think something bad's gonna happen. They think that they're going to embarrass themselves, they're going to criticize, कोई कर देगा, low self esteem है. तो they avoid almost everyone except their own family. और इसके जो manifestations, think about someone who's having social anxiety. उसको क्या होगा, वो they're embarrassed. ठीक है, लो सेल्फ इस्टीम में ब्लश कर होगा, हैंड ट्रेमर हो सकता है, एंड नोजिया हो सकता है कि दे फील नॉजियस, उनके हाथ कांपने लगते हैं और वो ब्लश कर रहे हैं. ठीक है, तो इसकी जो ट्रीटमेंट है दैट्स SSRIs एंड बेंजोज. ठीक है. So panic disorder. So have you ever seen someone have a panic attack? A girl in my class used to have panic attacks, and it was actually, they used to describe it as isko jinn chad gaya. ठीक है. So I want you to sort of think of along those lines. So there's no underlying situation. It's not like कि किसी reason से उनको panic attack हो रहा है. For example, अगर they're not asked to talk, get up on stage and talk. They're not asked to suddenly go and go like give a presentation. This is just something जो कि उनको panic attack वैसे ही हो जाता है from their own thought or something that they self imposed. तो इसमें recurrent anxiety attacks होते हैं. ठीक है, that's what a disorder is. Panic disorder is recurrent anxiety attacks, जिसमें ये सब हो रहा होता है. So it's very actually surreal. If you see someone have a panic attack, they'll actually say उनकी दिल की धड़कन तेज़ हो जाएगी, they'll have sudden anxiety, उनके chest will feel tight, सांस उनका उखड़ेगा, ये कि they might even start choking or gasping, fear of dying होगा कि वो इतना सांस उखड़ता है कि they think they're gonna die, or they're going mad, and dizziness भी होती है. तो it lasts for a few minutes, so it's not that long, but yeah, it's very detrimental to the patient themselves, and iska bhi SSRIs and benzos. ठीक है, तो generalized anxiety disorder, how is this different from just a normal disorder, anxiety disorder? एक तो it's generalized, which means that the symptoms usually persist for weeks to months, from at least weeks to a month. ठीक है, this is what you need for diagnosis. So it should be generalized, and a person is continuously nervous, trembling, muscle tension, palpitations, dizziness, epigastric discomfort होगा. तो generally जो anxiety के अपने symptoms होते हैं, that is what gives it away. Women में ये ज़्यादा होता है than men. ठीक है, इसमें भी SSRIs and benzos, लेकिन इसमें mirtazapine added है. ठीक है, mirtazapine. Now how do I want you to remember this? इसके generalized anxiety disorder है ना, this is lasting very long, so we're going to add something else in it too. This is the only thing जिसमें एक added चीज़ mirtazapine है. ठीक है, फिर let's talk about obsessive compulsive disorders. 3 I's: ideas, images, impulses. So someone has an idea, they think मेरे हाथ गंदे हैं, then they have an image. that image is, I need to wash my hands to correct it. Then they have an impulse that they have to go to the sink and go wash it. So ideas, images, and impulses. This enters a person's mind. This distresses them. So it's not that they think what they're doing is rational. They understand that they are being irrational and they try to resist, but they are unable to resist and they can't help themselves. And it leads to repetitive actions of pointless tasks. So they keep doing the same thing again and again and they can't help themselves. So the symptoms usually last for more than or 2 weeks. Because हो सकता है कि वैसे ही बंदे फॉर एग्जाम्पल आप बीमार हो जाएं एक हफ्ते के लिए, तो आपको फीलिंग हो कि यार मैंने अपने हाथ बार बार धोने. So that's another thing. So this has to last for more than 2 weeks. इसमें भी SSRIs and benzos देते हैं. Then let's talk about PTSD. PTSD is a delayed response, post-traumatic stress disorder. So it's a delayed response and this is also for weeks to 6 months. हमने यहाँ पे क्या पढ़ा था? Generalized is also from weeks to month. The other thing is post-traumatic, 6 to 6 months. ठीक है, it's exceptionally catastrophic event होना चाहिए. There should be evidence of trauma. For example, someone witnesses a war, that level of catastrophe. लेकिन इसमें यह क्या होता है कि उनको इतना trauma है उनको इस चीज़ का कि repetitive recollections will lead them to avoid stimuli. So how would that look like for someone, for example, who has experienced a school shooting? They don't want to hear any loud bang. So even वो construction sites को avoid करते हैं so that they don't have to hear these loud stimuli. And उनको कैसे how is it haunting them? Through their memories and dreams. Startle response होता है. SSRIs are the choice कि इसको कैसे करें. And then somatoform disorder is basically a repetitive physical manifestation, ठीक है, of physical symptoms. And they request investigations. तो वो जाते हैं, वो जाके for example अपना CT, MRI, CBC labs, they just get everything done. Despite no physical evidence and doctors' repetitive reassurance, they are convinced that there is still something left. Something. So this has to last for more than or equal to 2 years. तो ये सबसे ज़्यादा longest है. तो just to quickly recap, anxiety में हमारे पास क्या है? Symptoms हैं psychological and physical. Physical में वो सारी चीज़ें हैं जो कि आपको पता है. इसमें हमारे पास एंग्जाइटी से वेरिंग थॉट होता है, वेरिंग थॉट से रेस्टलेसनेस होती है, उससे हमारे पास सेंसिटिविटी नॉइज होती है, पोर कंसंट्रेशन एंड इरिटेबिलिटी. अगोराफोबिया, आईड रादर नॉट गो, ठीक है, सो दे डोंट वांट टू गो इन पब्लिक बिकॉज दे थिंक समथिंग बैड इज गोना हैपन, दे डोंट वांट टू गो अलोन. सोशल फोबिया, they don't want to go out because they're scared that something embarrassing is going to happen, someone's going to criticize them. So what two things? Can't eat, can't speak in public, ठीक है, can't speak to the opposite gender, ठीक है. इसमें avoids everyone except their own family. 3 हमने symptoms की बात की है कि उनको nausea होता है, hand tremor होता है, blushing होता है, SSRIs and benzos. Panic disorders, there's no reason, इसमें जिन चढ़ने वाले सारे symptoms होते हैं, last for a minute, SSRIs and benzos. Generalized anxiety disorder, generalized होता है, anxiety के वही सारे symptoms आ रहे होते हैं, women में ज़्यादा होता है, young women especially. Diagnosis के लिए क्या है कि generalized है, it has to last longer, weeks to months. SSRIs, benzos and metazapine. Why? It's an added thing. Why? Because it's generalized and long. Obsessive compulsive disorders. 3 I's: idea, image, impulse. They want to control it, they can't control it, it distresses them, it leads to them doing repetitive actions which are completely pointless. This has to last for more than 2 weeks क्योंकि बंदा बीमार भी हो सकता है 1 हफ्ते के लिए. SSRIs and benzos. PTSD, delayed response, has to have catastrophic events. कितना delayed? Weeks to 6 months. Evidence of trauma. Trauma comes in their memories, their dreams. SSRIs से हम वो treat करते हैं. Somatoform, repetitive physical manifestations but no underlying cause. For more than 2 years it has to last.